Hello everyone, welcome back to GrowMed. Welcome back to the Super 30 series, and in this series, today is the day 4. We will be discussing a very important topic, that is the jugular venous pressure, JVP, the waves of the JVP and the normal waves and the abnormalities associated with it. कि किस disease में किस type के वेव दिखती है. ठीक है. सो इट इज़ क्वाइट फेमस. इफ़ यू गो एंड एनालाइज द पास्ट ईयर्स, डेफिनेटली वन क्वेश्चन यू विल फाइंड इन ऑल द एग्जाम्स. ठीक है. तो डू नॉट मिस दिस टॉपिक. सो विल लुक एट द वेव्स फर्स्ट. सी दिस इज द वेव फॉर्म्स एंड देर आर 5-6 waves actually. A wave, X, C, X dash, V and Y. 5-6 waves. ठीक है. तो विल लुक कि कौन सा वेव क्या रिप्रेजेंट करता है. ए स्टैंड्स फॉर द रिलैक्सेशन ऑफ द एट्रिया, एट्रियल रिलैक्सेशन. तो यू कैन रिमेंबर बाय द नेम. मतलब ए से एट्रियल सी जेवीपी होल टेल्स अबाउट द फंक्शनिंग ऑफ द एट्रियम. ठीक है. तो एट्रिया की जो फंक्शन है उसको सिग्निफाई करता है एंड ईच वेव सिग्निफाइज वन incident or one thing happening in the during the relaxation, during the phase. Okay. So A stands for the relaxation phase. X contraction phase. Sorry, relaxation नहीं, contraction phase है ये. First atria contracts, right? So atrial contraction. Then X stands for the relaxation of the atria relaxation. And when the atria relaxes, with the force, there will be bulging of the tricuspid valve. See, this is the atrium. Okay, here this is the atrium. यहाँ पर present है bicuspid, tricuspid valves. This is the ventricle, this is the atrium. So whenever atria relaxes, there will be bulging in the tricuspid valve. So that one is denoted by the letter C. C signifies the tricuspid bulging. Then X dash stands for the downfall of the tricuspid valve. See, this tricuspid is there. No, when it is bulging like this, it is the C wave, and when it comes again to its normal position like this, then that signifies the X dash. Then what does V stands for? V stands for the passive atrial filling. That is the isovolumetric relaxation. Means, see, we know that first 70% almost is due to the force and 30% happens passively. If you might have read it in the physiology, okay, the heart cycle, everything about the heart cycle. So 30%, that percent will be happening in this V phase, that is the passive atrial filling. Then Y signifies atrial emptying of the atrium. Okay, so these are the important waves. So questions are asked like naturally also on these things, basic things, that A wave in the JVP stands for, or what does the A wave in the jugular venous pressure signify? So it signifies the atrial contraction. Okay, likewise the X for the atrial relaxation. So like this the waves are. Okay, then moving on to the moving on further, these were the normal things. Now we'll discuss the abnormalities associated with this and in which disease what kind is C. So pathological waves. A wave, if A wave is absent, then it is seen in case of atrial fibrillation. See, apply your basic knowledge here. The atrial fibrillation में on ECG what can we see? There is absent P wave, मतलब कि conduction हो ही नहीं. P signifies atrial, मतलब कि एट्रिया का contraction on the ECG is signified by this P wave. So P wave is absent in atrial fibrillation. Same apply the concept here. A wave is absent in the atrial fibrillation also. Okay, because there is no proper contraction of the atria happening. Then if A waves are large, then it is seen in these diseases PAH and pulmonary stenosis. So anything causing the uh, issue in the lung. So lungs like this. A wave signifies atrial contraction. Now here like this is the A wave. So this here it is connected to via the pulmonary artery to the lungs, right? Pulmonary artery to the lungs. So whenever there is anything issue here, it will be affecting this pulmonary artery, and pulmonary artery will be affecting this atria. So it is like this. So these are the causes. Remember this cause because these are asked in the exam. Like a large wave, A wave is seen in which of the following disease? Then cannon waves. Cannon waves are see, large A waves means the size will be bigger, but cannon means it will be more bigger, like this, larger than the A waves, more larger than the large A waves, and seen in two conditions, complete heart block and ventricular arrhythmia. ठीक है. So complete heart block में क्या होता है कि the atria will try to contract very very forcefully. So due to that very large A waves are seen. That's why they are called as a cannon A wave. Okay, remember these things. Then V wave. So large V wave is seen in case of tricuspid regurgitation. See, we know that V stands for what? Passive atrial filling. तो tricuspid regurgitation में क्या हो रहा है कि there is like what black flow of the blood through the tricuspid valve. तो इसीलिए it will be closing late. तो इसीलिए we can see this large V wave. Then X wave, this one is very very important. Note it down. I suggest you to write it on a sticky note and stick it on the study table or just mug it up, because this cardiac tamponade, it is थोड़ा सा confusing है but important भी है. So see, X wave, if it is steep, then seen in two conditions, cardiac tamponade. CT stands for the cardiac tamponade and CP stands for the constructive pericarditis. ठीक, तो cardiac tamponade and constructive pericarditis, steep X wave is seen, and X wave is absent in case of tricuspid regurgitation. ठीक है. Then Y wave. Y wave is steep in case of constructive pericarditis and tricuspid regurgitation, and it is absent in case of cardiac tamponade. This cardiac tamponade is a very important one. Let me write it down here. Cardiac tamponade. JVP findings seen in this cardiac tamponade is steep X and absent Y wave. Just remember this one sentence because this is asked multiple time, and in the clinical case also they can be described these features of the JVP, which will help you to reach the diagnosis as the cardiac tamponade. So steep X, absent Y, seen in cardiac tamponade. Similarly, ulta of this one, seen in the constructive pericarditis. In constructive pericarditis, both are steep. Both the X and the Y, both are steep. Okay, remember these two statements. Then another important finding associated with this JVP is Kussmaul sign. See, usually on inspiration the JVP decreases, but if it increases on the inspiration, that sign is called as a positive Kussmaul sign, and it is seen in three diseases. First one is the constructive pericarditis, second the restrictive cardiomyopathy, and third one the third degree heart block. So in these three conditions the JVP increases on inspiration. ठीक है, तो that one is seen positive small sign. ठीक है, so remember these also. So yes, this was all about the JVP, which you must remember. I hope this video will be helpful to you, and for more such amazing videos, subscribe to GrowMed, and for the series of the Super 30, subscribe to GrowMed. Stay tuned for the PDF. Join the Telegram channel. The link is given in the description box. I am Dr. Padmini, your mentor for the Fmge. Thank you so much for watching this video. Like the video, share it with your friends, and subscribe to GrowMed. Thank you guys. All the best for the exam.